Vanakkam, good morning. In this video, we are going to discuss about the Herring-Breuer reflex. Herring-Breuer reflex proposed by the Herring and Breuer in 1868. The Herring-Breuer reflex absent in the healthy eupneic man. Eupnea means normal breathing. Normal inspiration and expiration is called as the eupnea. Eupneic man. Absent in the normal person. Normal respiration. The Herring-Breuer inflation reflex threshold level is the tidal volume increases 1 to 1.5 liter. Normal tidal volume is the 500 ml. So normally this reflex is not activated. When the tidal volume is increases in between the 1 to 1.5 liter, Herring-Breuer inflation reflex is activated. It prevents the excessive lung inflation. Prevent the excessive lung inflation. It stimulates the stretch receptors present in the bronchi and bronchiole. So during the inflation, stretch receptors stimulated in the bronchi and bronchiole. The vagal afferent conduct the impulse, stretch impulse to the dorsal respiratory group of neurons. Dorsal respiratory group of neurons. The dorsal respiratory group of neurons are inhibited. Dorsal respiratory group of neuron is important for the inspiration. So the dorsal respiratory group is inhibited. So inspiration is stopped. Expiration is starts. So the Herring-Breuer inflation reflexes prevent the excessive lung inflation. It is activated when the tidal volume is in between the 1 to 1.5 liter. Herring-Breuer deflation reflex. It is opposite to the Herring-Breuer inflation reflex. Here the expiration and the expiration is prolonged. Stimulation of the alveolar receptors. It is impulse carried by the vagal afferent to the dorsal respiratory group of neurons. Here dorsal respiratory group of neurons are stimulated. So dorsal respiratory group of neurons initiate the inspiration and stop the expiration. So this is the Herring-Breuer deflation reflex. The prolonged expiration stimulates the alveolar receptors carried by the vagal afferent to the dorsal respiratory group of neurons. It start the inspiration, stimulate the inspiration and stop the expiration. This is a Herring-Breuer deflation reflex. The MCQ question is the false about Herring-Breuer inflation reflex. Option A, absent in healthy eupneic people. So it is absent the normal respiration. It is correct. So inhibit inspiration. So in the Herring-Breuer inflation reflex, inhibit the inspiration and stimulate the expiration. And C, determine the pattern of breathing during exercise. So during the exercise, it produces a deep inspiration. That is, determine the pattern of breathing during the exercise. Option D is the threshold level is at tidal volume 500 ml. 500 ml is the normal. So it is activated in between the tidal volume 1 to 1.5 liter. So the question is false about Herring-Breuer inflation reflex. The threshold level is at tidal volume 500 ml. It is a false thing. about the Hering-Breuer inflation reflex. Others are occur in the Hering-Breuer inflation reflex. It is absent in the healthy hypnic. It inhibits the inspiration. It is also determine the pattern of breathing during the exercise. So answer is D. The threshold level is at tidal volume 500 ml is the false about Hering-Breuer inflation reflex. Thank you for watching this video. If you like this video, press the like button and share your friends.